Stop believing that a stroke always arrives without warning, because what I'm about to tell you could save your life or the life of someone you love. Most people imagine a stroke as a sudden collapse that happens without any clue beforehand. But in reality, many strokes are preceded by subtle warning signs that are easy to dismiss. These signals are often mistaken for stress, aging, dehydration, or simply having a bad day. That misunderstanding is exactly what makes them so dangerous. Here is something that should immediately capture your attention. Research published by the American Stroke Association found that nearly 1 in 3 stroke patients experienced warning symptoms hours, days, or even weeks before the major event. Another large study published in the journal Neurology reported that transient ischemic attacks, often called mini-strokes, occur before up to 30% of major strokes. The encouraging news is that recognizing these early warning signs and seeking immediate medical care can dramatically reduce the risk of permanent disability. Scientific references are listed in the description below. Now listen carefully, because if you stay with me until the end, I'll reveal the #1 warning sign that many people ignore because it disappears within minutes, yet it can be one of the strongest predictors of a future stroke. Before we dive in, I want to ask you something personal. How old are you today, and have you or someone close to you ever experienced a stroke or a mini-stroke? Share your story in the comments because I read every single one, and your experience could encourage someone else to take symptoms seriously before it's too late. Let's begin. Number 5 is sudden, unexplained dizziness or loss of balance. This symptom often appears so mild that people blame it on standing up too quickly or simply getting older. But when dizziness appears suddenly without a clear explanation, especially if it is accompanied by difficulty walking, it deserves immediate attention. Researchers at Johns Hopkins Medicine have reported that sudden balance problems can occur when blood flow to the cerebellum, the part of the brain responsible for coordination, becomes temporarily reduced. Even a brief interruption can affect how your body maintains posture and movement. Think of your brain like the conductor of a large orchestra. Every muscle, every movement, and every step depends on perfect timing. If the conductor suddenly loses communication with one section of the orchestra, the entire performance becomes unstable. That is exactly what reduced blood flow can do inside your brain. One of my patients, Harold, a 71-year-old retired electrician from Michigan, experienced sudden dizziness while watering his garden. He sat down for a few minutes until it passed and almost ignored it completely. Fortunately, his wife insisted they visit the emergency department. Doctors discovered he had experienced a transient ischemic attack. Early treatment helped prevent what could have become a devastating stroke only days later. After the age of 60, arteries naturally become less flexible due to inflammation and gradual plaque buildup. Reduced blood vessel elasticity makes the brain more vulnerable to temporary interruptions in blood supply. If you suddenly experience unexplained dizziness, avoid driving, sit down safely, and seek immediate medical evaluation instead of waiting for symptoms to disappear. A powerful synergy tip is combining regular blood pressure monitoring with daily walking and proper hydration. Healthy circulation helps protect the delicate blood vessels supplying the brain. Number 4 is temporary vision changes. This warning sign often disappears so quickly that people convince themselves nothing serious happened. According to research from the Mayo Clinic, temporary loss of vision in one eye or sudden blurred vision can occur when blood flow to the retina or visual centers of the brain becomes temporarily restricted. Studies estimate that visual disturbances may appear in nearly 20% of patients before certain types of stroke. Imagine your eyes as cameras connected to the world's most advanced computer. The cameras may still function perfectly, but if the cable carrying information suddenly loses power, the picture fades or disappears. That cable is your blood supply. One patient, Margaret, a 69-year-old grandmother from North Carolina, noticed that the vision in her left eye suddenly became cloudy while reading the newspaper. Within 10 minutes, everything returned to normal. She almost forgot about it, but her daughter convinced her to see a doctor. Testing revealed severe narrowing of one of her carotid arteries, the major blood vessels supplying the brain. Early treatment dramatically reduced her stroke risk. After 70, blood vessels supplying the eyes and brain become increasingly vulnerable to cholesterol deposits and chronic inflammation. This makes temporary visual symptoms particularly important in older adults. If vision suddenly becomes blurry or disappears in one eye, even for a few minutes, seek emergency medical care immediately. Do not wait until tomorrow. A helpful synergy tip is maintaining healthy cholesterol levels through a diet rich in vegetables, fruits, olive oil, and omega-3 rich fish, while following your healthcare provider's treatment plan if cholesterol medication has been prescribed. Before we continue to the 3 warning signs that doctors say are even more dangerous, take a moment to like this video and subscribe. Every week I share evidence-based health information designed specifically for adults who want to stay independent, protect their brains, and enjoy healthier years with the people they love. Let's continue. Part 2. Number 3 is sudden numbness or weakness on one side of the body. This is one of the most recognized stroke symptoms, yet many people still delay getting help because the sensation often comes and goes. They assume they slept in the wrong position or pinched a nerve. Unfortunately, that assumption can cost valuable time. The American Heart Association reports that weakness affecting one side of the face, arm, or leg is among the strongest predictors of an impending or active stroke. Brain imaging studies have shown that even a brief interruption of blood flow can temporarily disable the nerve pathways controlling movement. Think of your nervous system like a network of electrical wires inside a house. If the power supply is interrupted to one side, the lights on that side begin to flicker or shut off completely. Your muscles behave the same way when brain cells are deprived of oxygen. One of my patients, David, a 74-year-old retired firefighter from Arizona, noticed that his coffee mug suddenly slipped from his right hand during breakfast. A few minutes later, everything seemed normal again, so he considered ignoring it. His daughter immediately called emergency services. Doctors confirmed he had experienced a transient ischemic attack, and prompt treatment prevented a major stroke only 48 hours later. After age 65, arteries supplying the brain become narrower because of years of cholesterol buildup and chronic inflammation. Blood flow becomes less reliable, making even short interruptions far more dangerous than they would be in younger adults. If you suddenly notice weakness, numbness, or facial drooping on one side, never try to sleep it off. Call emergency medical services immediately because every minute without blood flow causes brain cells to die. A synergy tip is maintaining healthy blood pressure through regular exercise, reduced sodium intake, and taking prescribed medications consistently. Blood pressure control remains one of the most powerful ways to lower stroke risk. Number 2 is sudden confusion or difficulty speaking. This warning sign can be frightening because it often appears without pain. A person may know exactly what they want to say, yet the words simply refuse to come out correctly. Researchers from the National Institute of Neurological Disorders and Stroke explain that language centers in the brain require a constant oxygen supply. Even a brief interruption can cause slurred speech, difficulty understanding conversations, or using incorrect words. Imagine your brain as the world's fastest translator. Every thought is instantly converted into speech. But if blood flow is interrupted, it is like disconnecting the translator's microphone. The thoughts remain inside, but communication becomes distorted. One patient, Carol, a 68-year-old librarian from Virginia, suddenly began calling everyday objects by the wrong names while talking with her husband. She laughed about it, believing she was simply tired. Her husband recognized the warning sign and immediately drove her to the hospital. Doctors identified a developing stroke, and rapid treatment allowed her to make a nearly complete recovery. After age 70, reduced circulation, chronic inflammation, and age-related blood vessel changes make language centers more vulnerable to oxygen deprivation. If someone suddenly develops slurred speech, cannot repeat a simple sentence, or seems confused without explanation, treat it as a medical emergency. Do not wait to see whether it improves. A powerful synergy tip is pairing regular physical activity with diabetes management because stable blood sugar helps protect the delicate blood vessels that nourish the brain. Part 3. Now we arrive at the most important warning sign of all. Number 1 is a transient ischemic attack, often called a mini-stroke. Ironically, this is also the warning sign that people ignore most often because the symptoms disappear so quickly. According to the American Stroke Association, approximately 1 in 5 people who experience a transient ischemic attack will suffer a major stroke within 90 days if they do not receive treatment, and nearly half of those strokes occur within the first 48 hours. Think of a mini-stroke like a fire alarm that suddenly stops ringing. Just because the alarm becomes quiet does not mean the fire has disappeared. It simply means you have been given one final opportunity to act before disaster strikes. One of my most memorable patients was Eleanor, an active 79-year-old from Oregon. While gardening, she experienced sudden weakness in her left arm, blurred vision, and slurred speech. 10 minutes later, every symptom disappeared. She almost stayed home because she felt perfectly normal again. Fortunately, her neighbor insisted on calling emergency services. Hospital testing revealed severe narrowing in a major artery supplying her brain. Early treatment prevented what specialists believed would likely have been a life-threatening stroke within days. After the age of 75, the body's ability to compensate for reduced blood flow declines significantly. Blood vessels become stiffer, inflammation increases, and the brain becomes less tolerant of oxygen shortages. This is why every warning sign deserves immediate attention, even if it lasts only a few minutes. The most important preparation tip is simple. Learn the FAST method. Face drooping, arm weakness, speech difficulty. Time to call emergency services immediately. Never attempt to drive yourself if stroke symptoms appear. Immediate medical treatment offers the greatest chance of preventing permanent brain damage. A synergy tip is combining healthy nutrition, regular walking, blood pressure control, cholesterol management, and avoiding smoking. Together, these habits dramatically reduce stroke risk and help keep blood vessels healthy throughout life. Now step back and look at the bigger picture. The frightening truth is that strokes rarely announce themselves with flashing warning lights. They often whisper before they scream. A few minutes of blurred vision, a brief episode of dizziness, temporary weakness, difficulty speaking, or symptoms that disappear so quickly you convince yourself they were nothing. But your brain is sending an urgent message. The encouraging news is that recognizing these signals early can mean the difference between complete recovery and permanent disability. Throughout my career, I have seen patients who ignored early warning signs and regretted waiting. But I have also seen many others who acted immediately and returned to their families with their independence, mobility, and quality of life intact because they refused to ignore what their body was telling them. Remember, protecting your brain is about more than preventing disease. It is about preserving your memories, your conversations, your ability to walk, to laugh with your grandchildren, and to enjoy the life you have worked so hard to build. It is never too late to reduce your stroke risk. Every healthy meal, every walk, every blood pressure check, every good night's sleep, and every decision to stop smoking sends a powerful signal that your brain deserves protection. If this video helped you recognize the early signs of stroke, make sure you subscribe for more evidence-based health insights designed to help you stay healthy, independent, and mentally sharp for years to come. And now I want to ask you something important. Which warning sign surprised you the most? And did you learn something today that you wish you had known years ago? Tell me in the comments below. I read every single one, and your story could help someone else recognize a warning sign before it becomes too late.